Good day, everyone. I am Legend Mayra Sinabe, and today I will be reporting to you the lipid-lowering agents, drugs affecting blood coagulation, and the drugs used to treat anemia. So first, let's talk about the lipid-lowering agents. So what are the lipid-lowering agents? Hypolipidemic agents, cholesterol-lower drugs, or anti-hyperlipidemic agents are a diverse group of pharmaceuticals that are used in treatments of high levels of fats, such as cholesterol, in blood. They are called lipid-lowering agents. These are drugs which lower the levels of lipids and lipoproteins in blood, while one group of drugs, statins, lower cholesterols. The other groups, fibrates, is known to take care of fatty acid and triglycerides. As what I have mentioned sa katong drugs, mo to siya ang mga lipid-lowering agents used to treat hyperlipidemia. The several classes of hypolipidemic drugs may differ in both their impacts on the cholesterol profile and adverse effect. For example, some may lower the bad cholesterol or low density lipoprotein, the LDL, and more so than others, while others may preferentially increase high density lipoprotein or the HDL, the good cholesterol, which is the HDL. Clinically, the choice of an agent depends on the patient's cholesterol profile, cardiovascular risk, and the liver and kidney functions of the patient, evaluated against the balancing of risk and benefits of the medication. Those are the lipid-lowering agents. Next, let's proceed to the drugs affecting blood coagulation. So, what are the drugs used to affect blood coagulation? First is aspirin. Second, clopidogrel or Plavix. Third one is the diprimadol persantin. Next is prasugrel Efient. Next is ticagrelor brilinta. And the last one is ticlopidine ticlid. So those drugs I mentioned those are the drugs used to affect the blood coagulation. This review of 2015 publications on drugs that affect blood coagulation, fibrinolysis, and hemostasis covers coumarin anticoagulants, heparins, direct thrombin inhibitors such as bivalirudin and dabigatran, direct factor XA inhibitors, apixaban, edoxaban, and rivaroxaban. The indirect factors, XA inhibitors, are fondaparinux, thrombolytic drugs such as alteplase and streptokinase. So those drugs are used to affect blood coagulation. So grabe kayo kay isod kay litokon ang drugs. And the last one sa akwang report is drugs that are used to treat anemia. So what are drugs used to treat anemia? So I will mention the anti-anemia drugs. First is the erythropoietin or the epoetin alpha. So this is the first drug that I will discuss. So trade names of these drugs: erythropoietin, Epogen, and Procrit. The drug class of this is drugs that used to treat anemia. Mechanism of action: a glycoprotein that stimulates red blood cells production. Epoetin alpha is 165 amino acid glycoprotein manufactured by recombinant DNA technology and has the same biological effects as endogenous erythropoietin. Hypoxia is primary psychological stimulus for erythropoietin production in the body. So the indications of these drugs is: first is chronic renal failure patient. Second is zidovudine treated HIV/infected patient. The third one is cancer patient on chemotherapy. So next is the contraindication of these drugs. The contraindication is uncontrolled hypertension or known hypersensitivity to either mammalian cell-derived products or to human albumin. The side effects of this drug is a rapid increase in hematocrit and hemoglobin. May cause hypertension. So, bantog na dahil nakakause siya og hypertension is because of the rapid increase in hematocrit and sa hemoglobin. And also the thrombotic complications. These can be minimized by raising the hematocrit slowly and treating the hypertension. So, the second drugs is ferrous sulfate. So, kita mo siguro tanan nakabaloan ning ferrous sulfate kay murag kanang familiar siya na drugs nga iron deficiency jud makatreat siya og kanang anemia ay anemic person. So, the trade name is generic. Drug class is used to treat anemia. Mechanism of action is iron combines with porphyrin and globin change to form hemoglobin, which is critical for oxygen delivery from the lungs to other tissues. Iron deficiency causes a necrotic anemia due to the formation of small erythrocytes with insufficient hemoglobin. So, the indication for this drug is iron deficiency anemia, blood loss related to pregnancy or GI bleeding, NSAIDs, hookworm infestation, or excess coffee. So, contraindication for this ferrous sulfate is patient with hemochromatosis, hemosiderosis, or hemolytic anemia. And the side effects for these drugs is for therapeutic doses, nausea, upper abdominal pain, constipation, or diarrhea. So, iron overdose 1 to 2 grams can lead to circulatory collapse and death. So, pag ma-overdose na atong patient with this ferrous sulfate can lead to collapse or death. So, the non-intentional iron overdose has been a leading cause of fatal poisoning in children less than 6 years old. So, makakos jud siya og poison sa children kung maun sa siya non-intentional iron overdose. And the third one nga na-search na ko sa drugs used to treat anemia is this iron dextran. Its trade name is Infed. Drug class is parental iron preparation. Its mechanism of action is same as ferrous sulfate but has a different route of administration. So, same lang daw ni sila sa ferrous sulfate ang kaning iron dextran. So, indication with this drug is patient with documented iron deficiency in whom oral administration is unsatisfactory or impossible. Example, malabsorption syndrome, prolonged salicylate therapy, and dialysis patient. So, mo ni siya mga indication ani nga drugs. Next is seldom used now. Newer orally effective agents include iron sucrose and ferric gluconate complex are most commonly used. So, the pharmacokinetics of this drug is given by deep intramuscular or injection or IV. Most adults with iron deficiency requires 1 to 2 gram of replacement iron or 20 to 40 ml. So its side effects is more side effects compared to administering oral iron supplements. Local pain and tissue staining, brown discoloration, headache, lightheadedness, fever, nausea, flushing, urticaria, bronchospasm, and rarely anaphylaxis and death. The next drug is folic acid. So, folic acid, trade name is Folvite. Drug class is drugs used to treat anemia. Mechanism of action is essential cofactors for synthesis of amino acid, pyranase, and DNA. So its indication is treatment of megaloblastic anemias due to a deficiency of folic acid, as may be seen in tropical or non-tropical Peru. In anemias of nutritional origin, pregnancy, infancy, or childhood. So, ang contraindication aning folic acid is folic acid should not be given alone in patients with pernicious anemia without knowing whether they also have a vitamins B12 deficiency. The danger is that folic acid supplements can mask the signs of vitamin B12 deficiency, yet not prevent the development of irreversible neurological disease due to vitamin B12 deficiency. And its pharmacokinetics is 1 milligram of folic acid orally daily is typically sufficient to reverse megaloblastic anemia and restore normal folate levels. So, its side effects is allergic sensitization. So, note for this, folate deficiency in pregnant women is implicated as a cause of congenital malformations in newborns. And then the last drugs that I search for this anemia is vitamin B12. So as what I have mentioned earlier. So its generic name is generic cyanocobalamin hydroxocobalamin. So drug class is vitamin. So vitamin B12. Mechanism of action is a cofactor for several essential biochemical reactions. So, indication for this vitamin B12 is used to treat or prevent deficiency of vitamin B12. The most common cause of vitamin B12 deficiency are fish tapeworm infection, partial or total gastrectomy, and various intestinal disorders that impair absorption of vitamin B12. So, pharmacokinetics of this is different formulations can be administered orally or by parental injection. And then the notes for this vitamin B12 is vitamin B12 deficiency leads to megaloblastic anemia, GI symptoms, and neurological abnormalities including the generation of myelin sheaths and axons of spinal cord and peripheral nerves. Vitamin B12 deficiency in elderly patients due to abnormal absorption of dietary vitamin B12 is relatively common and easily treated. So, that is all for my reporting the lipid-lowering agents, drugs affecting blood coagulation, and drugs used to treat anemia. Thank you for watching.